So we're in Durban for the International Conference on AIDS. It's the second time the conference is coming to Africa. The first time was in the year 2000. At that time, it was a very dark moment for the continent. With millions of Africans infected, almost no one was on treatment. But we're back in Durban 16 years later for the next international conference to be held in Africa. We've made a lot of progress, which is being shared on the conference, stages, on the poster sessions, and the exhibition, and probably the biggest success story on the continent in the 16 years between the last conference and this year's conference. There's so many more Africans on treatment for AIDS, especially in South Africa, where they have over 50% of their infected, about 3.4 million people, the largest public sector funded HIV/AIDS treatment program in the world here in South Africa. And they've reduced mother-to-child transmission by 85%. So it's proper, and it's a great thing actually that the conference has returned to Durban, the exact location they held 16 years ago. So the opening of this conference was simply amazing. It was amazing, firstly, just in terms of the logistical scale, getting 18,000 delegates into one room. I mean, kudos to South Africa for pulling that off. Secondly, it was great to see the children, the grandchildren of Nelson Mandela take the center stage. The opening actually happened on his birthday, his 98th birthday. So it reminded us of his promise. And finally, I think Charlize Theron really put a few big topics on the agenda. You know, that the response cannot afford to neglect the poor, adolescent girls, gay people. We can't let our moral judgments come into obstruct the response to the epidemic.
The epidemic isn't just in our laboratories and in offices or conferences like this. It is in our communities, and it's in our schools, and it's in our streets. Nelson Mandela said young people are capable when aroused, of bringing down the towers of oppression and raising the banners of freedom. If we support our young people, if we give them the confidence and the space to speak out against bigotry and injustice, if we take the time to listen and empower them, they will end this epidemic.
The defining moment for me at the opening ceremony was reminding us that, listen, to achieve the success that we really want, we have to think outside the box and really start taking some hard decisions to reach populations that may not always be reached by conventional methods. Okay, so again, the science in this conference has been incredible. I mean, it's got the most number of posters, abstracts submitted to any conference on AIDS ever in its history. And you know, walking around the poster stands, you just see the commitment of so many researchers to answering questions from the pure science to operational research to how to implementation research. I mean, people are really thinking and driving. I think that it's amazing that the level of enthusiasm around the science that drives the response has stayed so strong on the agenda after so many years. And you know, there have been a few frustrations. We still don't have a cure, but I think we do have the opportunity to change the trajectory of this epidemic with tools already available to us, right?
Anglo-American has started this campaign called Protest HIV, which encourages people to test themselves and know their status in order to properly treat themselves and to be more aware about the disease as a whole. Knowing more about the disease helps to lessen the stigma attached to it, and people aren't really discriminated against as much as they would be if people were ignorant regarding the topic. Each of these ribbons has a different quote by 10 different employees of Anglo-American. And on the inside there's an exhibit explaining the stories and the challenges and the experiences these people have had living with HIV in various countries from where they're from, mostly South Africa.
Is what? Sex work is what? Sex work is what? Sex work is what?
And one amazing thing about the International AIDS Conference is it's never just about the science. You know, advocacy has really played a big role in the trajectory of this epidemic. I remember in the year 2000, the theme of the conference was Break the Silence, and really the role of organizations like the Treatment Action Campaign and Section 27 in defining the response to the AIDS epidemic has been phenomenal. And that has been the same in this conference. You know, you step out of a scientific session, you walk right into a protest, you see a march, you go to a dance session, you go to the exhibition stand. So it's really a big fascinating mix of everyone that comes from different points of view.
I kick the blanket, I get out of bed until we see a brighter future in our children's eyes. Not much of what we do today has any value. I get into the shower.
So the global village at the International AIDS Conference is really something to behold, because it allows community and it allows people not actually registered for the conference to come and take part. They have their stands, they can show the work they're doing in communities, interact with delegates, and really participate in all sorts of innovative ways in the conference activities. And you see people from across the world. It's a real melting point. And to me, it's one of the highlights of this conference, just walking around there, soaking in the atmosphere, meeting new people from all over the world that I would never have met. And it gives you a real feeling that this is really a global response to a global epidemic. For us from Nigeria Health Watch, one thing that stood out is, there's been very little from Nigeria at this conference, considering that we have the second largest burden of HIV on the continent. We have the largest burden of mother-to-child transmission in the world. It hurts when you walk around and you see so very little out of Nigeria in such an important conference. Granted, there have been a handful of Nigerian researchers with posters and a handful of presentations, but by no means enough to demonstrate the size of the problem in Nigeria and what the response should be. So despite the many successes reported in this conference, we're still not where we want to be. The fact is that there hasn't been a reduction in new infections among adults in the last 2 years. So really, there's still a lot of challenges left for us to deal with. And really, we leave this conference reinvigorated in the importance and our desire to end this epidemic. We hope that we don't need international AIDS conferences in a few years' time, and we really hope that by the time we gather again in 2 years' time, there will be a lot more new research on things and methods and approaches, maybe a vaccine, maybe a cure. Is that too optimistic to hope for? No, not with the enthusiasm and the science that I've seen out of the 21st International Conference on AIDS in Durban, South Africa. So, we will keep informing Nigerians of what's going on in the health space because it matters to you and it matters to us.